are you? Are you ready? Okay, so my nurse tells me that you are here for a filler dissolvent in your lips. Okay, so what's the reason that you want to remove them? Okay, you want to go to a more natural state in your lips? Very well. I see here that you had other fillers in your face. How are those going? Oh, you helped them dissolve too? Okay, so the lips were the only ones left. Okay, let's see. Okay, it was 3 units that were done in your lips over the period of several months. You wanted to attain fuller, bigger lips. Okay, let's take a look. Have you had any issues with having pain, discomfort in your lips? How about a tingling sensation that maybe you feel like you need to scratch your lips? Nothing like that? Okay, that's good. Okay, well, the lip has been deformed from its natural state because of the fillers in these areas. And I'm not saying this in a bad way. It means only that the lip has gone out of its natural rim here. So you want to go back to how it was before? If it's possible, right? Okay. So this area here in particular is the one we want to take more right there. The bottom part is not as compromised as the upper lip, so we don't have much issue here. Now your natural lip, let me see on your file, okay? Okay, from the photographs that we have here, it had a good shape. Okay, only thing that you wanted to do was fuller and bigger in this case. So the deformity that we see here, we might not be able to get it back to how it was 100%, but I can get it to 80%. It's gonna look like your old self, but only a little bit bigger, only because of this deformity that it created multiple times that fillers were placed in this place. But it's not gonna be that big of a deal with time. We might want to go also with a steam treatment. This is to relax the lip. It has a serum on it in the steam that is gonna help with all this area right here. It's a new technique we are offering here in our clinic that, believe me, is, besides relaxing, very, very well for this kind of problems in your case. Now, I'll start by cleaning the area too. Now, I just see here that the last time that you had a filler was around a couple of months. Okay, let me just prep you up. Gonna move your chair a bit so you can face like this. Now let's start by cleaning the area. Now what the steamer does also is improve the health of the skin, especially some areas that I noticed that there are some issues with your pores. You might want to take a look into that. Yeah, normally takes around 3 sessions, but in the first one you're gonna notice a difference. Okay, now try to keep your mouth closed because this can be a bit bitter once it's applied. Okay. Yeah, it's a pretty distinctive aroma, isn't it? Makes you believe that it might be sweet, but no, it's very, very bitter. Okay, the area is clean. I'm gonna apply a bit of lidocaine for the discomfort because we're gonna be using a needle to dissolve the fillers, okay? This is gonna numb the lip, so it might feel weird. Also try not to do this or taste it. Again, quite bitter. Normally it takes a couple of minutes to start acting up. You're gonna feel a tingly sensation in your lips. Then slowly it's gonna start numbing the area. There we go. Okay, so besides the fillers dissolvent, we are also checking for the pores. Okay, so for your pores, what you're looking for is to close them, right? You feel that they have enlarged with time. Yeah, this is pretty common with age. It tends to happen to some people, but it's good to take into consideration before entering all later years when it's almost impossible to close them up. So right now you're on time. So the first session that we're gonna do with the steamer, it's gonna help you a lot. Okay, you're starting to feel the, don't talk, that's okay. You're gonna start feeling the tingling sensation. Okay, let me check your pores well. We are at it. This is just an assessment for today. We are only doing your lips, and for the full examination of your pores, I'm gonna have to see you in another appointment, okay? We don't have enough time to do both in the same appointment, but I know that it's something that concerns you about. It's okay, you can nod or just do this to respond. Yes, I just notice an enlargement of the pores. Not that big, but it started the process of enlargement. And you're just in time to start working on it. For the session of today, it's gonna be a great initial treatment for this. Okay, let's go ahead and start the dissolvent. Okay, you might feel a bit of pressure in your lips, but you shouldn't be feeling any pain, okay? Ready? Okay. How about that? Did it hurt? No? Okay. Good. 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 Okay, let's see from this side. Good. That's good. Okay. You're doing first the upper lip because it's the one that is most noticeable. It really takes a few minutes to start noticing the change. Let me get another unit. Okay, let's see. That's good. I don't see any reactions, so it's looking quite good. How about pain? No pain? Okay, that's important. Shouldn't be feeling any pain whatsoever. I'm going to slightly press the lip. Let's try to mold it. Okay, let's give it a little time so we can start working on the bottom lip. Again, try not to talk and not to taste the medicine. Quite bitter. And by bitter I mean that it's really hard to remove the taste from the mouth. Not toxic, of course, but not pleasant either. Okay, we're gonna use 3 units for the bottom. Hopefully with the 4 that we took in the top, it's gonna be able to get it back to its regular shape as much as possible, of course. I'm sorry. Okay. Let's work on the bottom. I was noticing that the solvent that you had in the rest of your face was a few weeks ago, so that was a great work. It looks quite nice. Very good. Now with the bottom lip, it's going to be quite easy to reshape because since it's larger, it takes a bit more of the fillers and it doesn't really change the shape, only gets fuller. So it's easier to just deflate it, as I would say it, like a balloon. Okay, let's press. any pain when I do this? Okay, good. Let's give it a little time, okay? Continue checking your pores. That's a very good work with the removal of fillers in the rest of your face. Now the enlargement, I would say it's at maybe at 10%. This means that it just started the process for the pores to enlarge. Sometimes it's due to being exposed to the sun a bit too much, even though if you're wearing sunscreen, when you're exposed to the light of the sun for too long, even with it can dilate the pores. So we want to take care of that. Also very important to start drinking more water, just plain water. It's going to help with that. If it's possible, I don't know if you actually consume these cigarettes or vaping, try to avoid it. That is a big enemy of the pores, especially if someone that started smoking early in their young teens. Okay, let's see. See, the bottom lip is very easy to mold. Quite easy. Top lip, that's the tricky part. Okay, try not to move, please. Very good. Let me grab something. Okay, one moment, please. Again, try not to speak or open your mouth because it's quite bitter. 1 second. Now what this is gonna do is make the lip into the shape that it was before. Of course not gonna be exactly the same, but should be close enough. Okay. You're gonna keep the mouth closed. Very good. Okay, now all we have to do is wait to check that the treatment and the procedure worked. Normally around the 5-minute mark is when we start noticing that the lip is actually doing what we want, and if not, we need to put a bit more of the solvent, okay? Let me just prepare the mister that we are going to be using on you today. Now this is going to be very relaxing. For your first session, it's only going to be 10 minutes. During this time, it's gonna feel a bit warm, almost like you are in a humid place, but it shouldn't be discomfort or anything like that, but it is gonna be warm. Okay, just so you know. What we can do is turn off the AC a bit more if you want. Okay, I'm gonna prep you up. I'm gonna put this to protect your clothing because there might be some dripping. There we go. Like that. I don't know if you want me to protect your hair too. Okay, I'm just gonna set it to the back. And I'm gonna place a cap, okay? There we go. There. Okay, it's time to check your lips. Bottom lip is perfect now. The upper lip, as expected, is fighting a little bit. So half a unit is going to be needed. Don't worry, still you're not going to feel anything. It's still numb, okay? There we go. That should be it. We don't need to place anymore. Because if we go further, it's going to make the lip shrink even more than what you had before. We don't want that. You have a very nice lip design form, so it's gonna look quite good even with the change of fillers and the sides, so don't worry about it. There we go. Okay. I'm just gonna place a timer of around, I would say 10 minutes for the steamer. I think that should be enough. During this time, I'm gonna lower the lights for you, for your relaxation, and I'll be back to check you out, okay? Let me just lower the lights one moment. Okay. That should be enough. I'm gonna place it for a 10-minute mark and I'll come back to check you out, okay? be on now. And in case that you need anything, we have a bell right here that is going to page me, okay? But I'll be back in a moment. Enjoy. Okay, just to let you know that I'm gonna turn on the lights now. It'll be a bit bright. Okay, the timer is off now. How do you feel? It was nice, isn't it? It's really, really relaxing. My patients love that part of the treatment. Okay, let's see, try you out. I'm gonna take a towel here. And the cap. Let's inspect your pores. Let's see if there was any difference. Yeah, there is a small difference, meaning that we are just in time to do the treatments like this for your pores. So I'm pretty happy to tell you that the damage that has been done to your pores can be reverted quite easily. Okay, so your lips look absolutely fantastic. Now you can look at yourself in the mirror. Isn't it? Big difference. It's not as 100% as you had before. As you can see here in the picture, we have a before and after. But I would say I managed to get it to 85%. It looks quite good on you. You like it? Oh, that's great. Thank you so much. Well, for now it will be everything for myself, and we're going to have a new appointment next week to see how your pores have developed, and hopefully we are not going to need to do any invasive treatment for it. Do you have any questions? Well, thank you so much. It was my pleasure. If you're all right here outside, the nurse is going to help you. Okay, thank you.